So this is part two of our tongue tie video series. We're just wondering, if you have been told you are possibly tongue-tied or you want to know how you can possibly assess for this. So in the first video, we talked about the anterior tongue tie and how to assess for it. In this video, we're going to cover the posterior tongue tie. So as you might recall, when we first measured Joe, he was able to open to 50 millimeters of full opening. So we'll do that again. Open as wide as you can, please. Right, we'll get in there. And we have Joe again very consistently at 50 millimeters. Now, what will be hard to show you is then when it comes to a posterior tongue tie, what we want to try to do, first of all, I just try to get people to cluck. So if you at home try to cluck, right, you're kind of forced to get the top of your tongue to press against the roof of your maxilla or the roof of your mouth, correct? But then beyond just the cluck, you really want to try to fill up the entire roof of your mouth with even the back portion of your tongue as well, which can always be a little bit harder for someone. So we're going to ask Joe to first cluck. And again, please. And now, in an effort to get your tongue all the way up there, but not cluck, try to get your tongue up and fill up the whole roof of your mouth. Keep it right about there. And then you're going to now measure between those central incisors again. And in Joe's case, he's at 20. So for Joe, that would put him at less than 30%, right? So when it comes to a grade 1, when it comes to assessing for a posterior tongue tie, it's usually if you can open 60% or more of that range, that's going to be considered normal. 30 to 60% limitation of range would be grade 2. Anything at less than 30% is a grade 3, and anything less than 5% is a grade 4. So we would put Joe currently at a grade 3. The other thing that is just important to notice, sometimes someone can be tethered more to one side. So in Joe's particular case, again, if you could see, he is able to sort of get the back upper portion of his tongue to elevate, but he has a much harder time on that left side. So again, you can also see some asymmetries with these tongue tie cases as well.